Welcome back to Britology. Today we're diving into one of the most important and talked about topics in the UK right now. What's really going on with the NHS in 2025? For years, the National Health Service has been both a symbol of national pride and a point of national concern. It represents free healthcare for all at the point of use, something many people in the UK feel defines the country's values. But here we are in 2025, and the NHS is facing pressures that are sparking fierce debate, urgent reforms, and some very difficult questions about its future. Let's start with the big picture. The NHS has been under growing strain for more than a decade, but the pressures have intensified after the pandemic years and the cost of living crisis that followed. Demand for healthcare has reached record highs. The population is growing, people are living longer, and more of us are living with multiple chronic conditions that require ongoing care. That means more GP appointments, more hospital visits, and more reliance on an already stretched system. But the resources available to meet that demand haven't kept up. Funding has risen, but not enough to match the scale of the challenge. And so patients and staff are both feeling the squeeze. In 2025, one of the biggest issues is waiting times. Stories about patients waiting months or even years for routine operations like hip replacements or cataract surgery are now commonplace. The NHS backlog, which grew sharply during the pandemic when thousands of operations were postponed, has proven stubbornly difficult to clear. Even though extra funding and new targets have been announced by the government, the backlog is still in the millions. For patients, that means living with pain and uncertainty. For the system, it means constant firefighting instead of forward planning. Then there's the issue of emergency care. Accident and emergency departments across the UK continue to face overwhelming pressure. Ambulance response times have been another flashpoint. There are still cases where patients have waited hours for an ambulance, and even longer outside hospitals waiting to be admitted. It paints a picture of a system struggling to provide urgent care quickly enough. And that has very real consequences for people in life-threatening situations. Of course, none of this can be understood without looking at the workforce crisis. NHS staff are the backbone of the service, but in 2025 they're stretched thinner than ever. Chronic shortages of nurses, doctors, and care workers mean that existing staff are working exhausting hours. Burnout is a serious problem. Morale has been hit by years of disputes over pay, pensions, and working conditions. We've seen waves of strikes by junior doctors, consultants, and nurses, all of which reflect deep frustration with how the service values its people. Recruitment drives are underway, including efforts to bring in more overseas staff and expand training places, but it takes time to train new professionals. In the meantime, many wards and GP surgeries are operating with fewer staff than they need, and patients notice the difference. Technology has been hailed as one potential solution, and in 2025 there are some real advances being made. Digital consultations have become much more widespread since the pandemic, and for many routine appointments they save time and resources. AI tools are starting to play a role in diagnostics, helping doctors spot patterns in scans and tests more quickly. But technology alone can't fix the deeper problems. Not every patient is comfortable with digital care, and not every medical issue can be solved through a screen. Investment in new systems also requires money, training, and time. Three things that the NHS often feels it doesn't have enough of. Another key part of the story is social care. The NHS and social care are supposed to work hand in hand, but in practice the system is still fragmented. Hospitals often can't discharge patients because there's no care package available for them in the community. That creates bed blocking, where hospital beds are taken up by people who don't need acute medical treatment but can't safely return home. This in turn reduces capacity for new patients and contributes to the long waiting times we mentioned earlier. Attempts to reform social care have been talked about for years, but progress has been slow, and the lack of integration remains a huge pressure point. So what's being done about it? The government in 2025 is under enormous pressure to show results. Billions of pounds have been promised for modernization, new equipment, and recruitment. There are initiatives aimed at cutting bureaucracy, streamlining services, and improving productivity. Targets have been set for reducing waiting lists and speeding up access to GPs, but critics argue that many of these plans don't go far enough. They point out that real funding per patient is still lower than it was a decade ago once you adjust for inflation and rising demand. Others say that without a long-term workforce plan and a bold new vision, the NHS risks lurching from crisis to crisis indefinitely. There's also the political debate about whether the NHS model itself needs reform. Some voices argue for more private sector involvement to reduce waiting times and take pressure off public services. Others warn that this would undermine the founding principle of universal free healthcare. It's a deeply emotional issue in the UK because the NHS isn't just a service, it's a symbol of fairness and equality. Any hint of moving toward an American-style system sparks fierce resistance. Yet, at the same time, more people than ever are paying for private healthcare, simply because they can't wait for the NHS. That shift is raising difficult questions about whether access to healthcare in Britain is really equal anymore. For ordinary people, the experience of the NHS in 2025 is mixed. Some still have wonderful stories of compassionate care, life-saving treatments, and dedicated staff who go above and beyond. Others feel let down by long waits, rushed appointments, and a system that seems to be constantly on the brink of collapse. Public trust in the NHS remains high, but confidence in the government's handling of it is another matter. Polls show that healthcare is one of the top issues for voters, and with an election on the horizon, it's likely to play a major role in shaping the political landscape. So what's really going on with the NHS in 2025? It's a story of contradictions. A service that still delivers incredible care, but one that is struggling under the weight of demand. A workforce that is both heroic and exhausted. A system that inspires national pride but also national frustration. The NHS has always been called the closest thing Britain has to a national religion, and that's still true today. But like any institution, it needs renewal to survive. The challenges are immense, but the stakes are even higher, because at the heart of this debate are people's lives, health, and futures. As we move forward, the big question is whether Britain can find the political will, the investment, and the innovation to safeguard the NHS for future generations. One thing is certain, this debate is far from over, and the choices made in the next few years will shape the service for decades to come. That's all for today's deep dive. Thanks for watching Britology, and we'll see you next time.